Hey there, everyone. Welcome to a PAD Leg Saver Hotline podcast. And we have a great group of folks. Make sure you join our live in studio audience for our weekly hangout. Meet other group members at info at padhelp.org. And don't forget to subscribe to our channel if you're watching on YouTube to spread awareness for PAD and let more people know that we have great hangouts like this where we can learn from each other. We have actually Deborah who decided to join today. I think, Deborah, this is your first time joining the group. You want to tell everyone a little bit about yourself?
Yeah, I've been part of this group on and off for the last 2 years. I think that's how long it's been. And sometimes I listen in, and you may not see me, and
Oh,
little sneaky when I
sneaky,
say.
sneaky, sneaky.
Uh, I am a PAD patient, obviously, but I'm a little bit different than most PAD patients because my peripheral vascular disease is microcirculation, not big arteries. And
Yeah, you're an anomaly.
yes,
You are the
I am.
greatest anomaly I have ever seen. And I have to tell you, everyone has to hear this because it's just crazy. I couldn't believe when she told me what one vascular surgeon told her, said, "You're not sick enough for me and my team to actually treat you." A vascular surgeon said this to her, but then basically come back when you need an amputation. It's like, what?
That has been the general message from vascular surgeons at Hopkins.
Well, we didn't mean to call them out.
They don't tell
I
you. They
will.
don't tell you to walk or nothing.
No. They told me, as I said, I have microcirculation problems, not arterial. So they told me that there is basically nothing they can do except to amputate my foot. Well, that's not going to go over big with me. And having
Sounds like
been,
two of them.
I'm sorry.
That
Oh
sounds
yeah.
like the U of
Okay,
M
we can leave.
hospital.
Let's leave the clinics out of the conversation. We'll talk in generalities. Oh, get in trouble here. It's each patient has their own experience. I'm sure hospitals get that. So
Some are very good and some aren't. And I've been fortunate enough to be in several hospitals with having microcirculation problems that were phenomenal and treated me and literally saved my life and my legs.
yeah, they worked on your heart and your legs.
Yeah.
That's
I
incredible.
in 2000 suffered a stroke, and in 2004 I suffered an embolized shower,
Oh
and
God.
the blood clots took up home in my toes and foot. And I had been to everybody in Baltimore, orthopedic, neuro, vascular, somebody to help me. Nobody could understand what had happened to me and why this was going on.
Yeah.
Because I went to bed one night and I was fine, and I wake up the next morning and I've got ischemic toes. And they looked like little eggplants. That's how purple they were. And I spent an entire year in bed because I could not walk. And I actually took medications that were out on the market as investigational drugs, anything to save my feet,
Yeah.
because I was
You were
not going.
desperate. Yeah.
Yeah. And I traveled throughout the United States looking at clinical trials, and I did not fit any of the criteria for clinical trials because I didn't have large vessel disease. I had microcirculation problems or small vessel disease.
Yeah.
And for those of you who don't know about small vessel disease, I had what I call the trifecta because
Yeah.
my peripheral vascular system was affected. I'd had a stroke and I've had a heart attack. So I got the triple trifecta. So nobody knew quite what to do with me. There wasn't anything available back in 2004.
Nope.
Not a thing except to amputate. And as I said, that wasn't going to happen. I happened to find a physician very serendipitously, I can't speak tonight, who took a chance on me, and I took a chance on him. I didn't fit his clinical trials, so he contacted the FDA to get a compassionate waiver. And he treated me with a medication or a drug called VEGF, which is vascular endothelial growth hormone. And it was being tested for diabetics to see if they could reverse some of the damage that happens with diabetic patients in their feet. I didn't have diabetes, so I didn't fit their criteria. The FDA did a compassionate waiver, which was unusual. It took 6 months, but I got a compassionate waiver for them. And they did the VEGF injections. I had injections once a week for a month. And I got return flow to my feet.
Wow. That must have been a painful 6 months, though, waiting. I mean, I think everyone in this room can actually attest to and will relate to what ischemic pain feels like.
Well, and by the time they started treating me, I had gone from ischemia to necrosis.
Oh, wow.
So I had little tiny piggies that were necrotic, and nobody could figure out how to help me or what to do or why it happened. And this brilliant researcher scientist took a chance on me and gave me the VEGF and watched me for a year. And I did okay, but it was not the end result that I was looking for. I was looking for being normal again, but that
Mhm.
wasn't going to happen with just the VEGF. So he helped me get out to Northwestern University Hospital in
And
Chicago,
Chicago.
where they were doing some work with stem cells, but not for vascular disease. There was a wonderful physician out there who really did world renowned work. Literally, he
Mhm.
traveled all over the world treating people. And they were going to do a clinical trial for vascular surgery. But again, I didn't meet the criteria.
Mm.
Not a one. All my ABIs are normal. My blood flow is there. It's just microcirculation. And I got him to treat me. They gave me stem cells, and
Wow.
I grew new blood vessels. You could
Oh,
actually
interesting.
see the process happening because my toes went from necrosis to pink in 30
Huh.
minutes.
Wow. Wow. And
And it
so
lasted me up until 2 years ago.
isn't that incredible? And that's when you revisited the situation and people were telling you again that you needed you're not sick enough and just come
Yeah.
back when you need your foot amputated.
Yep.
Because there's nothing they could do. So fast forward,
So here,
we put you on a conference call with Hemostemics, which is a brand new stem cell company that is doubling down on PAD. They sent me this invite. They wanted a bunch of patients to show up. And since I don't know the company that well, and we're not about companies advertising to patients and promoting to patients, I'm even against the whole pharmaceutical thing where they pitch to patients. I I I said, great, I'm going to send one because she has a medical background. She was a nurse practitioner over actually at Hopkins. And so she has a lot of clinical experience. So, and she would be the number one to benefit and take advantage if it was something that was appropriate. So I sent Deborah. And so tell us about hemostemics and what you learned. And you were so excited. And I feel bad that
oh,
I kind of rained on your parade and have delayed this conversation. And instead of one-on-one, I'm like, hey, let's just share it with everybody. Tell us about this new potential option for people who are no option patients. We have Marie who's here and Thomas who's here who have been told and one time or another, no option. So if you can grow new blood vessels with stem cells and it's readily available and potentially covered by insurance, this could be huge.
Well, it's for me, when I heard this, I was so ecstatic. Kim will tell you, I couldn't stop. I mean, I was just thrilled with these people because I knew exactly what they were talking about because
Yeah.
I had had this done. So I knew who were the good guys and who were the frauds. They're not frauds. They are the true people that can save lives and save limbs. They started this process several years ago. They do have a clinical trial running
Okay.
in Florida.
Oh, interesting. Okay. Is it just
And
one site or does it have multiple sites?
the second site is in the Bahamas. They
Okay.
have a clinical trial, but they also have a buy package, I guess you could call it, when you don't meet the clinical trial, but you still want the cells. You can buy them now from them, which is unheard of.
Oh my
Um,
goodness. Well, at what cost?
well,
I guess, you put it on a credit card and hope to God that you can pay it off. I
well,
mean, for my dad, his costs for his stem cells when he's gotten them like in his knees, thousands of dollars.
mhm. It's expensive, but at the same time, it does work. You're going to get that blood flow back. And I have looked for years for somebody doing this. And there's all these people out there that will tell you that you're getting stem cells and you're paying a lot of money. And you
Mhm.
see the medical tourism all over Facebook. And they're really doubling down on the stem cells. These are not stem cells that they're selling.
Oh, okay.
God only knows what they're selling. Unless you are
Yeah.
getting your own cells, you have no idea what you're getting.
Yeah.
Okay.
So what does Hemostemics offer? What is their product?
Their process, and I know this because this was exactly what I went through.
Okay.
You do a blood donation just like you would at the Red Cross, but you do it in their labs. They take your blood, they send it out, and they re-engineer those cells so they get them to grow to like 600 million cells. And then those cells are returned to the company
Hmm.
and to the person who did the donation.
Okay.
They are not systemic, they are directly injected into foot and calf muscle. And there is evidence that what they're doing is working because they saw changes in people's toes that were necrotic return to normal, and the necrosis and the gangrene and all of that healed. And they had a great success. They're running about 83% success rate.
Wow, that's actually really high. Where are they
Mhm.
finding? Did they talk about the ones that they don't seem to be a fit for
And
and the
that's
reason they're
when
not a fit?
that you can buy the cells then if you want them. If
No, I
you're
mean,
not a fit. Mhm.
no, but I mean, if it's an 83% success rate, why the failure? Who is it failing on? Did they discuss that, or I mean, it was an it was a seminar
Yeah.
to advertise in a sense. So I don't know if they discussed the failures and why. Might
Well,
be something we have to ask.
it's mostly comorbidities that were the cause of the failures.
Okay.
Um, because most of us are pretty sick by the time we get to this point. So it's not unusual to have multiple um, conditions going on, but their rate is still very high. And the comorbidities were the only thing that prevented some people from having a positive response. But so you'll get your cells back, and that way you know they're yours. You don't have to worry about any reaction to them, which is great because you can have a allergic reaction, but when they're your own stem cells, that's
Yeah.
not going to happen.
Interesting.
Yeah.
So the people, so they do have the trial. It's
Mhm.
the only place right now it's available, correct? Except for
Correct.
if you decide, okay. So, but they will offer them to patients who are there at their sites at no charge
If you're in the clinical trial,
if you're in the
good.
trial.
Right, there's no charge. If you're not in the trial, there is a charge. And it covers lab processing and stem cells and all that. And it's doable for some people. For others, it's outrageous. But it is $50,000.
Holy cow.
Wow. Let me tell you something though. That is not unusual when you listen to these medical tourism sites for $50,000 and $80,000. That's what
Oh my
they're
Now,
charging.
I don't know much of anything about this, but I know that's not surprising because I have a due to go Friday for another consultation about my mitral valve and a stent procedure that is they say is in clinical trials, and Medicaid had denied me the procedure last year, but
Mhm.
I'm coming up on being 65. I'm going to get Medicare, and Medicare will pay for it. But so it looks like I'm going to have to go through consultations and maybe some more tests on my valve and whatnot before any procedure would be done. But I was talking, I had a lawyer, we were fighting the Medicaid denial and had discussions with him about trying to start a GoFundMe
Yeah.
thing and whatnot. And it came around to the cost of this procedure. And I mentioned, I off the top of my head, so I think about 50,000. He said go higher,
Mhm.
much higher.
Yeah.
So yeah,
There's a lot that goes into getting cells. And the research that happens, and that's basically what you're paying for, is all the research that was done so that you can get those cells. I have paid for cells. I've been outside of clinical trials where they were offered to me at no cost. But, when you're desperate, and I was desperate, I had necrosis in toes. I was desperate. I would have done anything in the world to take care of it. And
Yep.
I traveled
sure.
literally across the United States to all these places with clinical trials to be told I didn't meet the criteria. And there was one physician, and he said this to me, and I will never forget him. It's what drove me. He said, whatever you do, do not allow anyone to amputate your legs.
Hmm.
He says, don't allow it.
Wow.
And it stuck with me. And I
Yeah.
kept looking and looking. This process was a year long for me, finding somebody to take care of me, finding somebody who could help me medically, because I kept getting turned down. And I kept saying to people, turning me down at those clinical trials, what do I do? And they just shrug their shoulders because there wasn't anything.
Yeah.
And I was
And
desperate.
Imelda is asking a couple of questions in the chat. And Melda, you can always jump in. We love hearing your beautiful voice all the way from Southern California. And she's asking about what it means of showering of the emboli. And it's just clots that literally you have an event that causes clotting and you end up showering clots. And a lot of people end up with the clots in their lower extremities, all the way down into their feet. And
That's where it
if they're small enough, they
settles.
can just trash your foot.
Mhm. That's where the clots will settle. What happens is that the heart will push out these clots at times when there's an underlying pathology.
Yeah, like
And
valvular issues
right,
or AFib. It could even be for an aneurysm. We've seen clotting events for people who have cancer. So there are a lot of reasons aside from just hereditary issues, that hereditary clotting disorders and such.
yeah,
Smoking, other external factors can also contribute.
yeah. And I didn't have any of those clinical factors, not a one. I didn't smoke. I didn't have a history of clotting disorders in my family. But I did have cardiac disease, one of my trifecta favorites. And that's what caused the clotting. And I didn't have one clot. I had a whole shower of little clots.
Yeah.
And they settled all in my feet, my
Oh,
toes.
wow. Yeah.
And interestingly enough, it was only 1 foot that it happened.
And you know what's even crazier is there are so many patients that we've had come in and they're like, I don't understand. My doctor says that I don't have any problems, and yet my foot is cold. And they've done an ultrasound, they've done an ABI, and they said, I'm fine. I don't have PAD. And
Yeah.
as soon as we get them um, to have a TBI, or we have get them to a technologist that has that offers pedal acceleration time or PAT, it's in the foot, and it's usually stemming from a clotting event that their foot was trashed. So it's always important for every single patient, if you think something's going on, you really need to make sure that your vascular technologist, your RVT, has the experience to go clear to your toes, that they will, check, do the TBI on your toe. More and more RVTs they have the new measurement of pedal acceleration time, which is becoming more and more important. So just a thought, and I think that could have helped you,
Yeah,
Deborah,
but
with your diagnosis early on.
it wasn't available though. I mean,
No,
this
it
is
wasn't.
20
They weren't
years
doing
ago.
it. No.
No, this is 20 years later. And I'm just,
I know, and you still have your feet.
I do. I
She
got
has
both
her
of them.
piggies.
I
Yay.
still got
But
piggies.
man,
And
it's
here I
been
am
such a
20 years later and
yeah.
finding someone who does the exact procedure. And that's why I know it works, because it's exactly what I had,
So
step
can we
by
get you
step.
down to Florida? Can you get down to Florida? Did you tell them, hey, I'm in? Hello,
Uh-huh.
how can I get into the
If,
trial?
well, I'm not going to meet the trial, not going to meet the criteria for the trial.
Why is that?
I don't have, as our famous Dr. B says, big artery disease.
Are you kidding?
No, I don't have big artery disease.
So is this a trial for the FDA? Can we get another
Hmm.
compassionate? Can
You
we get
may,
another?
you may. It's very specific. Um, well, let me back up. It's specific for me. It is a trial for people with impaired microcirculation.
Okay.
But they are seeing others. They're going to be doing cardiac as well.
Oh, interesting.
And what is phenomenal is that you can actually see these vessels grow. It's so exciting. I didn't have anything in my feet, no vessels. They were all clogged. And you could see them opening up because everything turned pink again.
Isn't that amazing?
And, I'm laying in Northwestern Hospital in one of their beds, and I have all of the residents and fellows from immunology, because that's what the physician was, an immunologist, standing around watching and waiting, because they had never done this before. They had never used stem cells, and they certainly had never used it for peripheral vascular disease.
Yeah.
And nobody knew what was going to happen. And they just all stood there and watched. and could not believe you could see the return of blood flow to these areas. It was just absolutely phenomenal. And I still have them, and they did fine for 20 years. So, got a little bit of microcirculation impairment going on. So, it's just my timing again was perfect.
Oh, that's amazing.
My timing 20 years ago was perfect. Nobody had ever done it. And my timing this time is perfect.
Well, as long as you can somehow fit into it, we got to get you that compassionate.
Well, I don't know that that's going to
clearance again.
happen.
Well,
I'm
we
not
can,
sure.
you never know. I mean, I'm
know.
sitting here with Thomas Mink, who is the president and CEO, who messaged me just the other day. And I'm looking, let's see what he said. They wanted me to have everyone, but I don't send general patients to a patient seminar where they're just being pitched something, especially that's $50,000. But you were the perfect
I
um
was the perfect
the
candidate, having had that stem cells before, and could tell
app
the
and you're a nurse
difference between,
practitioner.
well, I could tell what was real and what wasn't real. You
So
know,
it looks like we're originating what they call a basket phase 1 clinical trial at Doctors Hospital in Nassau, in the Bahamas, to study the effects of autologous angiogenic cell precursors at the earliest stage of cardiovascular disease, including
Mhm.
PAD, ICM, I don't know what ICM is, DCM, and I don't know what DCM is, pain, angina, and longevity. Why? Well, our 498 treatments and 7 publications of 318 subjects studied. Oh God, this is just geeky. ACP-01. If you know any of this stuff, Deborah, please tell me.
That's the title that
Product?
they're using. Yeah, the product.
Okay. At the end stage, no option phase, CLTI, angina with success. Since we know it works at the end stage, we may as well prove it works at the beginning stage. Oh, interesting.
Mm-hmm.
Then it is logical that it may work at any stage. Let me know if you have a moment to catch up. Thank you for directing. Oh, hello. They know who you are. Thank you for directing Mrs. W to us. Much appreciated. And I have his phone number. So
They were great. They really were great. I did not feel at any time that there was any pressure to do this. Not at
that's
all.
nice. Who was the doctor? It looks like. So they have this Dr. Shang, Hsiang. Anyone
Yes,
have a pronunciation?
that was as close as I could get.
Okay.
Sounds right. Sounds right.
I'm wishing that Heinz would chime in here. Heinz is usually really good with all these new technologies and questions about them, and interest in a lot of these. So Heinz, in the next few doctors, when we have them on, you got to bring this up, okay?
Well, I'm hoping
I'm looking
you'll
up
have
some of the
both.
info that Deborah
Oh,
provided.
good.
I'm still,
Please.
it's still mind-boggling for me. So and I came in late to to the meeting, so I'm kind of catching up here. But yeah,
It's
I'm still looking stuff up.
what are the two different types? There's because I had the other with my own blood, but it wasn't, they didn't call it stem cells. They called it
PRP.
PRP.
Yeah, that is vastly different from stem cells. PRP is the plasma of your blood, and it has anti-inflammatory principles to it, and it is often used to inject into knees and elbows because it will help with the inflammation and take care of the problem.
Yep.
And it's great. It works well, but it is not stem cells. It can't regrow anything. Stem cells can cause angiogenesis, which is the growth of blood vessels. And that's what you want to happen when you're talking about PAD or cardiovascular disease. You want those vessels to grow.
Yeah. And I'm sending a note to Thomas right now. So in case people are wondering, because I'm the only thing that everyone's seeing on screen right now is me, and I'm looking down and I'm looking at my phone, but this is how I roll. And so right now, as I am on my phone here, I am trying to message the CEO. What do you think if we could get the CEO literally spontaneously to show up? Wouldn't that be the coolest thing ever?
They're
We are
worth listening to. They are definitely worth listening to.
wow, it doesn't have a good autocorrect of what it autocorrects to. So I'm gonna see what he says. It would be pretty cool. Did you talk to the CEO? Was he on at the time?
Yeah, he was on, and Lawrence Fromm was on.
Okay, yeah, he's contacted me before as well.
Yes,
Uh,
they were both on.
That's really nice. So did they have a lot of patients that showed up, or was it mostly clinicians or friends and family?
You couldn't tell. You couldn't tell
Oh,
because it was a Zoom.
and so they did it as a seminar, so you couldn't
Yeah.
see other people in the room.
No. Mm-mm.
Okay.
So I just sat and listened to what they had to say, and then I had a phone call with Lawrence Crom and Thomas afterwards.
Really?
Mm-hmm.
How did you get that?
They just asked me if I was interested in doing stem cells, and I said yes, and that's how things kind of started rolling.
So you were in this seminar, but they could see you, but you couldn't see everybody else except for the
Right.
ones that were talking.
Right.
Oh,
Right.
interesting. Were you asking questions in a chat or something?
No, it was just straight
So they just
information.
so they just happened to see you in chat and they said, "Hey, can we talk about this
Well,
with you?"
they also they offer you an option with a phone number if you have questions,
Okay.
and that phone number was directly to the CEO.
That's
And
amazing.
yeah, and all you had to do was tell them you had questions, and that's what I did. And we had a nice chat for a half an hour or so about stem cells and what they're doing.
That's incredible.
Mm-hmm.
So, what is your next steps with them?
Well, I went through the process of doing a release of information, and we talked about meeting criteria once again, and their nurse, their RN, is in the process of finding out, do I meet safety criteria for the cells? They have to go through that. You know,
Okay.
you have to make sure that people are safe. You can't give you can't give stem cells like this to people with cancer, that sort of thing. So they have to make sure that you're relatively healthy to get the cells.
Gotcha. Wow. And so would you have to pay for them or could you participate in the trial?
I don't meet the clinical criteria for trials. So
Right. But, if you do the compassionate thing,
I don't know if they're willing to do a compassionate waiver. They take a long time, Kim.
maybe we can inspire them.
No,
Hey,
I
you've done
don't
a
know.
great job. You've inspired them in the past. So I have no doubt, that you could, but you're doing pretty well right now. You found a new doctor. We had a couple new great doctors, but
Yeah.
we found one closer to you who got you in right away. And he offered you a few options at least. Are you getting any relief at all in the meantime?
My toes are still purple, but I'm pain free.
Oh, good. Well, pain-free is good, but we want to make sure we keep those toes and
Yeah.
keep them and get them their color back, and make sure they don't get further. I mean, is it what's making them pain free? I mean, if they're still
Well,
purple,
what's making them pain-free is we've added 2 vasodilators to my
okay,
regime. One is topical, which is nitro paste, and the other one is a medication that I take daily. That is a vasodilator. So
okay,
that's how we're taking care of them at this point. But they're still cold and they're still
mhm.
purple. But the vascular surgeons that I've seen are not concerned at this moment because my pulses are good.
Okay.
So we're
Hopefully all the
okay.
way, hopefully all the way to the toe.
Yeah, my pedal pulses are present.
Okay. We want
So we're-
TBI. We want them to put the clip on the toes.
Yeah, but
So
see,
Kim, what's
nothing.
the company's name?
Hemostemics. HEMOSTEMIX. And I'm curious for
ST
Marie's. Sorry, go ahead.
STE Hemos
H
S ST.
MIX.
HEMOSTEMIX.
You said that they're doing trials in Bahamas. When I look at Bahamas, must be
Yeah.
a haven for trials because I see all kinds of stem cell trials going on in Bahamas.
Well, the thing with the Bahamas is their laws are a whole lot less stringent than ours are with the FDA.
Yeah.
Makes sense.
So that's
But
why a lot of these guys.
a separate question. Your toes are still purple, but
Uh-huh.
you have no pain.
Uh-uh.
So Kim, my toes are purple. I have no pain. Is that bad?
Your toes, well, it depends. I mean, there's a certain color purple and there's a necrotic purple. I mean, you can have purple toes. I mean, I get because I have Raynaud's. So my toes are always permanently discolored and cold, and it's not PAD. I've been tested a number of times. Just found out
I
my
have
dad has
neuropathy.
mild PAD.
I have
You have
neuropathy in there,
neuropathy.
but I've had that for years. But one foot is nice and pink, and the other one is purplish. Of course,
Mm-hmm.
I have no pain, but I walk a heck of a lot too.
See, the other thing too, you have to remember that yours is the result of a large vessel disease. Mine is small vessel disease.
Makes sense. Yeah, makes sense.
And I still have pulses in the large vessels. So that's what's keeping my toes going.
Yeah.
You know,
Okay.
and Kim has set me up with 2 of the best vascular surgeons I've ever met, and they're absolutely wonderful. And they're both keeping a close eye on me.
Yeah. I need a favor. I have just a quick urgent patient situation, wondering if Marie can do me a favor and quickly text our friend that starts with the letter A and find out if he was actually at Rush Hospital in the emergency department, because A's doctor is messaging me right now saying there is no record of A being in Rush Hospital, which I was told he was in by A. So can you do me a favor and just double check with him if it was Rush? Because I'm going to look really stupid.
All right. Thanks, honey. I'll let me be here all night. Bye.
Whoops, is that Marie?
I'm messaging him, but
Oh, cool.
I'm thinking it wasn't Rush he was at.
He told me he was at Rush and wanted me to see if I could get a bed. He said he wanted a bed at that hospital. See, this was actually supposed to be the discussion we were going to have today until we ended up with a more interesting topic. But it's just really, it breaks this circle of trust when I get a message saying, I need you to contact B to get me a room. I refuse to go through Rush's ER. Like, what do you think that would mean to me?
Okay, I'm looking through our messages from earlier today when he was there, and he was at the local one,
Okay,
and
well,
he
that is
he
disconcerting
said he would
because
contact. He
Mhm.
said he would have contacted you if he needed his surgeon at the other one, but he's home. He messaged
yeah,
me a
that's
while
pretty
ago and told
embarrassing.
me he was home.
This is the issue that, and now everyone can see, I have been posting in our PAD supportgroup.org because we've had situations the past few that people take for granted and disrespect the work
Mm.
that we do. And this is 100% just breaking the trust of the circle and completely embarrassing because I don't know anyone, I'm going to call it out and I don't care because this is just really not okay. The note that was in here specifically, and I don't know if anyone would think differently. Would you, am I wrong? Would you have thought that that patient was anywhere else but that hospital where the doctor is? If they're asking you to get them a room,
Yeah, they have to be there.
wouldn't you
Yeah,
think? What, and then the
well,
whole
'cause
time I'm sending notes and saying I'm updating the doctor and I'm saying I'm sending them to get, did
well,
they check with that doctor?
it turned out not to be what he was thinking it was.
Right,
It's
but
not
that's not my
that.
point. But that's not my point. Is the entire time you can tell by my responses and the communication that I think they're at the that that person is at that hospital.
Oh, all right, yeah. From what I gather from
Right.
the
Okay, we
messages
get the
me and him
picture.
have, I don't think he was at Rush.
Right, but that's not the indication that I was given, and that's not fair. And now we have this doctor involved that is now messaging me going, and I'm telling him, no, he was there. He left. And it makes me look stupid
But that's also
and
going to
breaks the
affect
circle of
other
trust.
patients. It's going to affect other patients,
It
Kim,
affects other
that
patients.
that you
Yep.
refer,
So
you know?
after this, right, exactly. It affects the next person. If
Mhm.
people are not clear and the communication is not clear, this is exactly what happens. It breaks the circle of trust. And when I dedicate my time and I've built these relationships, if we have a new process that I was going to announce today, which I might as well announce now, which is with every patient that we work with, I wanted to make no barriers to getting help. But because of the disrespect that so many have recently shown our organization and all of our efforts and the doctors that literally commit their time, there needs to be a step back for people when working with us and working with the doctors that we work hard to help expedite care to, is we need clear communication and an understanding that we're going to jump through every hoop and fight every step of the way until you say when, until you say you call time, until you call time, we are going to continue to explore every option. Right, Deborah? I mean, we're
Yeah.
down to literally, you told me I'm not taking no for an answer. So we're looking every step of the way, whether it's a $50,000 option or not. I mean, we're just going to explore and offer those opportunities. Thomas is the same way. Where's Thomas?
I'm
Thomas,
here.
oh, there you are. Thomas, right? We don't give up. What are we doing now? We're
Uh,
now exploring something different and creating the connection for you directly with a company. And now I'm so proud of you advocating for yourself and fighting that last mile to get this new product because you don't have any more opportunities for procedures.
but
This would be
apart from
ideal for
this,
him.
I think I really want to do AI as well. I really do. That's my other opportunity if I can get it to be on an AI trial. And
Or I'm not
What,
sure what you mean by AI, but maybe
I
a
don't
stem
know.
cell
all right,
trial or a
there,
hemostemics trial, right? You could get to Florida. You're not that far from there.
Kim,
no,
don't forget
I'm only
too,
like in a flight, 2.5, 3 hours.
Yeah,
Drive, you
you
know,
could get there.
I would go there if, just to see what they can say. Every option's open, you know.
Thomas, if you want their number, I'll be happy to give you their number.
Right.
And
That would be great.
additionally, Kim, let me just remind you that we have a contact with a company that volunteers to fly patients to appointments at no
Oh, interesting.
cost.
Yeah, what's the name of that organization?
It's called Pilots for Christ.
Hmm.
It's a Christian organization, and I've actually used them. They flew me to Boston and Chicago for my stem cells, and there was no charge for the flights.
Wow. That could be really incredible. And that could be an option, Thomas. So if that ever, becomes something that we need to do, then we will get, and Deborah maybe can help us, at that point, I'm sure with Deborah's charm.
You'd be surprised what
Yeah.
I can talk people into. But Thomas, I used this flight 4 times in my past, and they were wonderful. There
Right.
was no charge for my flight. I used them because at the time before the stem cells, I couldn't put my feet down because the
Right.
pain was excruciating. I had to have my feet elevated. Where are you going to elevate your feet on a flight? So I
Yeah.
had.
You see, I'm going through a similar pain
Mhm.
at the minute, but it's not the normal pain that I've been through. It's actually worse than when I dislocated my shoulder falling off a scaffold. I've had the pain from being blocked up and everything, but this time round, and I think all I can put it down to, I had it twice though, two different procedures. When I blocked up completely straight after them, you know, that's the twice I've had this pain, but it's a complete different pain to claudication. I feel it in my bones, my toes, my ankle, all the way up.
Yeah.
And it's harsh because like at nighttime I get 2 to 3 hours sleep. That's what I
Yeah.
get in a day, and it's driving me crazy. And I'm so tired, and I'm so tired from being in constant pain with it, chronic pain. So
Probably.
Can I get clinical here, Kim?
Yeah, please.
Thomas, what are you taking for pain?
no, I take over the counter. I can't. They won't give me anything for pain.
Because of what reason? What's the rationale?
Really, I don't know.
Have you seen a pain specialist?
No, not as yet. And for me to find a pain specialist through my insurance, it's going to take about 6 months.
Mm. What state are you in, Thomas?
Yeah.
Louisiana.
What's
Yes.
your
That's actually that's actually classified as a stroke relief. So we call it a TIA.
I
Or
hear
mini.
background noise somewhere.
yeah, I do too. I don't know what that is.
Oh, that's Marie.
Yeah,
Oh.
It's
you
all
see,
Marie's fault.
I would have to.
Sorry, I'm
I
at
would.
the hospital. I ain't got a lot I can do. I'm gonna get
Thomas,
off here
have you?
though. My night nurse is in here and we gotta do meds and stuff, so I will
Okay.
talk with
Thanks for
everybody later.
checking. Appreciate it. We're here for you, Marie. We're rooting for you, Marie.
I love you,
Bye-bye.
Kim.
Good luck. Right.
Yep.
You see,
Thomas,
the other problem that I fight is my insurance. It would have to be. I would have to do everything through a medical trials. For the stem
Yeah.
cells.
Yeah, if you could get medical
because
trials.
my
then-
insurance I know wouldn't pay, and I just can't afford that money. You know, I wish I could,
Sure.
but
No, I understand completely. My concern for you immediate though is what is happening with pain for you. I know what that pain feels like,
yeah.
and it's excruciating. It feels like your body is on fire.
Well, it's not that. It's really deep.
Mhm.
It's the deepest pain level I've ever had, and I went
Mhm.
through a lot of bad things. I had to have surgery to keep me alive from and everything, but this pain is like it feels 1 minute it's trying to ease a little bit, and then it's almost like it's laughing at you back in your face. Haha, I got you, and it's right out 100%.
And
Yeah.
your vascular surgeon is not comfortable in prescribing
I think a lot of
Prescribing.
it.
Prescribing what?
Medication for pain.
Oh, yeah, it's a little,
I know things are sticky right now with pain.
it's always sticky, and especially in these situations with PAD,
right.
they just don't
Okay.
prescribe the pain medications, and most of the pain medications in my experience, and I wish Marie was still here, they don't cut through that ischemic pain.
No, they
We've
don't.
had
Yeah.
no, I mean, they try gabapentin, they
Doesn't
Lyrica, I
work.
think is another one. The only one that I've heard from some patients, but it's almost impossible to get, is what's the generic for Valium? And it's not Valium, it's
Diazepam.
lorazepam. And I've heard that actually
That's another
works in
benzo.
desperate situations, but I'm not clinical. I can only tell you what people have told me, and always have the discussion with your doctor if it's right. But I have heard that it has just taken the edge off a
Yeah.
little bit. So,
Have you explored a block?
oh, that's interesting. A nerve block. They are doing, if you go see an interventional radiologist, I'll have to look. The Society for Interventional Radiology has a website, sirweb.org. And you can use their doctor finder and click on pain management. And there are some IRs that are experienced with PAD that do have some temporary options, such as a block, that could help in the meantime if it's appropriate for your situation.
Yeah. I would definitely look at a block if it's possible.
Yeah,
It's gonna
that's a
give you
good
your
point.
your best relief and your longest relief, because meds are going to only last you 4 to 6 hours.
Right. And you see,
Yeah.
like Kim was saying though, I did some they did give me a prescription for 2 weeks supply of, I can't remember the name of the medicine, but it's it was an opioid.
Mhm.
And it really didn't do nothing for like
No,
my pain.
I took morphine my first go round, didn't do a thing.
Right.
Not a
And
thing.
and really the only thing that where I never felt pain was when they gave me anesthesia.
Oh yeah.
You know,
Yeah.
I was out, but
That's why
it's
I'm thinking a block. You know,
yeah.
if you can get a anesthesiologist or interventional radiologist to do a
Right.
block.
And you see the other thing with that is my insurance again and being on Medicaid. They they can send me, I could go to a pain specialist.
Mm-hmm.
But they're going to prescribe Tylenol extra strength.
Well, they will,
Eh,
but if you do interventional, they'll do things like a block or,
yeah,
pain pump or, all those things down the line. But if you don't find an interventionalist, you're not going to get anything else because the meds aren't going to work.
Yeah.
I mean, that's just the bottom line. And that's the only option I can think of until something else opens.
Yeah. But going back to AI, AI was doing, or they're starting clinical trials this year, supposed to be in May, where they put a nanobot in. It's not painful or anything, it goes in through your arm like an IV,
Mm-hmm.
and it goes through, and they control it by computer or laptop or
Oh,
whatever.
is this the one? This is the one I think from Sweden that we did a story on. Did you ever see the
Yes, I
artery
did.
report?
No, I didn't see the artery reports, but I'll tell you what worries me about it. Because of how my arteries are, I would be kind of afraid of doing that in case it just get too close to the edge and my artery ruptures. You know, it's I just don't know what route to go down. At the minute, for now, I'm hoping I can get my boots. You know,
Yeah,
that'll
the
help build the
BioTap has
tobacco's.
some boots.
Because when I spoke to Ray, he asked me about pain level and stuff like that, and I explained to him. I said, "Look, I'm in excruciating pain. I don't know why."
Yeah.
And he said, "Look, it'll help with your pain, even if it don't take it all away. If it brought it down to 80%, because I've got a real high pain tolerance, but once it gets past 100, I feel every bit of that pain."
Well, personally, I think Kim, you and I ought to beg Tom and see what we can come up with.
Yeah, I mean, I'm thinking that at the very least, I think that in the situation we have actually there are four of you that I think we should send down all at once, and they should do something with you guys. There's you, there's Thomas, there's Marie, who was just on a second ago, and we have another person, Derek, who's also in the Illinois area, and it would be fantastic. The thing is, if you guys don't make the trial, I know they mean well, and I know that this type of technology is still in the early stages, and I know insurance is not going to cover it for probably another 10 years, despite the evidence. There's not enough evidence. They just don't want to spend $50,000. But you know what? $50,000 for stem cells to save the leg versus $50,000 to cut off the leg plus rehab plus a prosthetic plus. I would think it would be worth their while. But most of the patients that I know, and I'm looking at Marcia and Joe and Heinz and everyone else. I mean, God, who can afford $50,000? I mean, you could say, well, my leg is worth it. If this is the only option, I'll put it on the credit card. If I have a $50,000 max, I can take out a loan if I can get approved for a loan for 50,000 and then declare bankruptcy if I needed to, if I couldn't pay it off. But God, that's a lot of money.
Yeah.
I think we ought to beg and have a conversation with Tom at the Naples, Florida facility and see if we can work something out.
Yeah,
I mean, the worst
I
thing
think
they
that
can
would be,
tell us, I think the worst thing they can tell us is no, and we're no worse off than we are now.
yeah.
But we've got to start, and if we don't say anything, then we may have missed an opportunity. I don't know if they have a mechanism for gifting to people or scholarships. Some of them call this kind of treatment.
The thing is with PAD, I honestly, and it's a market and I get it. I can understand, let's say, where they could get someone with cardiovascular disease that might be able to afford 50,000. But I can't see, unless it's Deion Sanders, man, we should get Deion Sanders this information because he could pay $50,000
Mhm.
and he actually could really use this type of technology because he has a similar situation with clotting and it
Yeah.
keeps going down into his foot and he's already lost toes. And as you know, there are only so many times that they can go into the calf and the foot to try and treat it. So the key is to open it up just enough to get you walking and moving, heal any wounds so that you can build the collateral vessels. But if you could have a little nudge, you could um, give it a little bit of a boost.
Well, you're not going to
That would
find out
be
unless you
so
ask.
helpful.
Not going to find out unless we ask and beg,
Yeah.
you know, and I'm not above begging.
How about any type of GoFundMe? That's probably
I doubt
Well,
that it's going to be hard to get that kind of money from GoFundMe, but again, you don't have anything to lose if they tell you no.
right.
But
That's
if
what.
you
Yeah,
don't do
that's what.
anything, you know, if you don't do anything, then you really will lose.
yeah.
Right. Right.
Yeah. So, I mean, goodness.
Kim, do you know
It's going
all
to be
these?
interesting. I
Do you
I
know?
just think that the demographic is I think it's like dangling a carrot in front of people and saying, "Ooh, there's an option. Show me the
Yeah,
money."
yeah.
And that's really hard. So hopefully their clinical trial will get them to a certain point to create enough evidence that insurance companies will help foot the bill. Foot, do you like that? Help foot the bill for I didn't do that on purpose. I totally did not do that on purpose.
Well,
That was uh, in 20, not in hindsight.
yeah.
But yeah, so that would be the ultimate goal, but everything has to have a start and it's so nice. And I think even for Thomas, it's promising, right? It gives you hope that if you can just take
Yeah.
one more step and one more step and one more step and have
Mhm.
something in the meantime, right? That technology and innovation is moving at the speed of light. And if we could just keep things going another day and grit those teeth
Mhm.
and keep persevering through that wretched, debilitating pain that medication just barely, if at
Doesn't
all,
touch.
cuts through.
Yeah.
And we have something new coming in almost every single day. So it's worth fighting. You don't have any wounds. It's really worth fighting. But as I said, we will fight till you say when. We might
Mhm.
even fight when you say when, just in case.
Yeah.
We might still nudge.
Yeah.
We might still, we're still going to provide hope that if you
Yeah.
change your mind, just if you change your mind, just in case, we're still here. I
Mhm.
tell everyone I'm going to be your royal pain in the arse. Just gonna be. I'm going to keep fighting. You know what? I got to hold this light for you. If you can't hold the light, I'm going to be here holding that light right alongside you. So every step
Well,
of the way.
she's not going to give up. That's obvious.
All right,
Kim,
Deborah, I don't give up, do I?
no,
I'm kind
you
of
don't. You
relentless.
don't give up. But I would like to get you um, hobnobbing with some folks that have money that can start helping some of this process.
Yeah,
It'd
no,
be
it would really
Yeah.
be nice. And it just is so frustrating and I can't divulge too much, but it's just like over and over and over again. I feel like everyone in all the other, these other groups and stuff are always trying to work against us.
Mhm.
And it's here's little Kimmy. Oh, isn't she cute? Oh, she's not a doctor. She's just cute and sweet and full of life and has so much energy. Oh, isn't that sweet? She's helping the patients. Oh, she's studying me another patient. And, that kind of attitude and not taking, what we're doing really seriously. And they
Yeah.
want to own the education on patients. Everyone wants to have you guys. Everyone wants to own you guys. Everyone wants you to go to their websites for education. They want to make money off of you clicking on their website for information. They want to be the source. They want the money to go to them for every one of your clicks. They want to be the
Mhm.
go-to.
There's a
You're
word
right.
for that. It's called grifters. Grifters.
Mhm.
Oh, I
Grifters.
don't know.
Yeah.
Really?
Yeah.
Yeah,
There's a
they're,
lot of
Everyone
they're
wants
in
grifters
it for
out
the
to,
there.
money. They're in it for the
they
money.
and that's what's really frustrating is that they can't come to us and say, wow, we love what you're doing. How do we collaborate? Which we are the ultimate collaborators. And I put the call out even now for everyone. We will collaborate. But even today, when I was like, hey, we're doing what you guys say you want to do. And so why don't we collaborate? We've already done something with this. The first thing they say is, oh, well, we'll have one for patients and we'll have one for doctors and it'll be owned by us.
Hmm.
There you go. They just told you who they are.
And I
Without
was just
saying
like, wait, what happened to collaboration? And it's, oh, by the way, we want to be the patient facing ones. We want to be the go to for everybody. And I said, well, why don't we become the little sister advocacy arm for all of your organizations? I don't care. You can provide the main general education as you want to do, but then we will continue and you drive patients to us for the personalized opportunities, the comprehensive stuff. We're not trying to take patients away from anyone.
But Kim,
We want to collaborate.
they don't do what you do.
No, but they want to take all the money that
Right.
straps our arms so we can't do what we do so that they can get all the clicks and all the glory. But they're still not they're not reinventing the wheel. They're like literally spinning the same wheel over and over and over again and doing what everyone else is doing over and over and over again and not driving anything forward. We're driving things forward. We're making a tangible difference. And I have done it now for 6 years without a paycheck. I live at home. I don't go out with friends. I literally am heads down, saving life and limb and building this from the ground up. And it's constant people coming in to try to undermine us and undermine us. And every one of these people who is undermining us, trying to undermine us, they get a paycheck.
Hmm.
They have a paycheck. And then they collect everybody else's money too.
Yeah. Well, there are a lot of
What
grifters out there. You
saying
got to be
about
careful.
Global PAD Association, they just don't take us serious.
I don't know if it's that they don't take us serious. They know that we may have an impact,
So they may
but
be
it's
takes
also
too serious. They don't like
it's
the
just that
competition.
they don't like the competition and they want to own it and they almost like they're like, yeah, I see you. Yeah, I see you. Thanks so much for sending patients our way. I see you. Isn't that cute? You know, they see
Yeah.
the impact we're having, but they don't want to invest in what we're doing. I mean, every one of the people, they all tell me, they all watch me, they all love what I'm doing, but they won't put the money behind it. They want, we even had this one industry, and I don't mind, this is public. Like this is the reality of what's going on. And they all put the money into organizations and stuff that are, you know, where doctors are involved. And I get that. But even this one company was like, well, we normally, and I knew it was targeted towards me and they watched what they were saying, how they were saying it, because they didn't want me to go, well, wait a minute, you could be giving us money. I've asked you for money. And so they started to say, yeah, we normally give money to only physician and clinician run projects. But I think in this case, we'll make, and then he kind of backtracked. He's like, well, since you also have a membership, so it is really a fit. So we will definitely send money your way to back your projects. And I was like, really? Really? We are the most groundbreaking in terms of what we are doing and having the most tangible impact. And I think that the direction that so many are going in just trying to drive general campaigns and, um, with general videos and general education websites and destinations. It's not the way to go, because all of you guys, what do? You go to ChatGPT, you go to Claude, and you say, okay, show me a list of every single doctor who on their website shows limb salvage, and you're going to have a list of all those doctors. Show me a list of every single trial that mentions peripheral artery disease. You're going to have a list of those trials.
Oh,
So,
yeah.
right?
Oh,
So,
yeah. I've got a
all
list.
right, all of this kind of investment, not going to happen. That's why I've built this the way I did, because I still think the personalization is where it's at, right? There's still value in the network, in the connections, in the conversations. And so that's what we want to continue doing. That is our focus.
Well, and I think it's been a good focus, Kim, and to continue to do that and to set yourself apart from other people out there, I think is the one benefit that you have that nobody
Yeah.
else does.
Yeah. It's the conversations that we can
Mhm.
have.
Well,
And
it's the
so,
personalization that you do.
yeah, and the only
Makes
thing
the
is that my board argues, how is this scalable? So that's going to be, the question, going forward is, what is the scalability? And I've been able to gather, so far 4 other people in our network. They're all volunteering their time right now, but they all have the experience. Actually, 3 of them have the experience that I do and the network that I do, with the same facilities and the same um, industry contacts, to be able to do what I do. And they all answer the hotline, 1-833 PAD legs. This is the PAD Leg Saver Hotline podcast. Woo! Like the video, subscribe to our channel. Just
Yeah.
a reminder. But they so it is possible that we scale and we do this. I think there are other organizations, like for cancer, Outcomes for Me. And this is what they do. It's all about the personalization, the customization.
Because and that's so important, because those of us that have chronic conditions, chronic pain, we're isolated. And very few of us have contacts outside of the house. A lot of us
Yeah.
are housebound. And
Yeah.
being able to hear that voice on the other end of the phone telling you to call this doctor, that they're expecting you and they can help you, is you can't understand what that does for a person who's experiencing desperation.
Yeah.
And that's exactly what this is. This is desperation when you have PAD.
Yep. And especially, at this stage of PAD. And I think it's going to be another 10 years before we really get, a handle on the amputations as a whole across the board. I think there's still surprisingly too many variances in care. What is really promising is I'm hearing more and more facilities are starting their own limb salvage program, which is exciting.
Mhm.
And that is, and their own limb preservation panel. You guys are familiar with Dr. John Phillips, who is on our show. He is starting an amputation review board. I heard over in Toledo, gosh, what was the name of their organization? They've started an amputation review board. I think they have it at University Hospitals, which is right across actually from Cleveland Clinic. University Hospitals, I think they have a full-fledged limb salvage program, and I think that they have their own amputation review board. In El Paso, Texas, the Limb Preservation Society is the go-to for amputation review and limb salvage and coordination for limb salvage, which they're wonderful. So we're seeing, little by little by little by little, we're seeing these things pop up, but we're still most concerned about the smallest communities, community hospitals. For example, an hour north of Milwaukee, we had a patient's daughter call us in the middle of the night, 1 o'clock in the morning, 12 o'clock actually, midnight, her time, which was 10 o'clock my time, and saying that her mom had an amputation scheduled for 8 o'clock in the morning. And they could have transferred her to their sister hospital, which is a larger level 1 trauma center, and which has a vascular surgeon, but they said they didn't check they didn't do a vascular evaluation on her because they don't have a vascular surgeon at their hospital. And so they just were going to perform the amputation. And I sent the dad in there and I said, or her husband, and I said, you need to tell them no amputation unless her life's on the line without a proper vascular evaluation, period. And
Yeah.
so they were able to get her out of there and get her to another hospital to actually save her full leg. Because if you amputate that toe and there's no blood flow and she's
You're
stuck in that
going up and
hospital,
up and up. Yep. you're going
exactly.
Up the leg. The
Exactly.
toe's
It's
only
never just the
starting
toe.
point. Yeah. The toe's
Yep.
starting point.
Yep. Exactly.
Yep.
So,
I understand completely.
well,
Well,
Deborah, it was so fun having you on. I'm so thankful that you joined us. I'm hoping everyone learned a little extra something, had a little extra hope. It was a
That was
surprise.
interesting.
Yep.
That was
Yeah.
very interesting.
Indeed.
well, I will be happy to give you Tom's phone number, Thomas, if you want that, and see what you can do talking to them. As I
Can you
said,
can you send it to me on Facebook chat, please?
oh God, here we go, Kim. I'm not so good at that.
No, do you know how to
I
put it
know
in?
another way.
Yeah,
Could you
could-
send
I
it to Kim?
actually, yeah, just send it to me. I think I
I will.
have it. I just texted him. He wasn't answering I'm hoping it was his cell phone. I'm thinking, it said it was his delivered, not read. So I'm wondering if it is one of those, maybe it's a landline. I don't know. Sometimes it'll say though, if it's a landline, just not delivered. But he's not saying he's reading any of his messages. And I'm looking at his social media profile right now, and it's not lighting up. So he might not be online at all.
Have you tried
5:36
Lawrence
or
Prom?
8:30 his time.
Have you tried Lawrence Prom?
Oh, I could have messaged him. I have trouble. I have my big old microphone right here. And so it's sitting on my mouse. And so it makes it just darn near impossible um to use my mouse and my computer. It's hard for me to move it around. I have moved it around a little bit, but yeah, I didn't even think about it. I'll just be honest. I should have thought about it. I just thought if we could get the CEO, that's kind of more fun.
Well, I think, to be honest with you, Lawrence Crom really is the bigger gun than Tom.
Oh, really?
Yeah,
Bigger
Yeah.
than the CEO?
yeah, yeah.
Hmm. Maybe he's chairman of the board.
I don't know, but I talked with both of them at one point. I talked to them both on the same time, and prior to that, I talked to each one of them individually.
Oh, cool. Well, I'm
So,
excited to, they do want to talk to me, so I'm hoping that maybe I'll connect with them tomorrow.
well, you will, because they asked me how I found out about this webinar. And I said, oh, Kim sent me. And they said, Kim McNicholas from P.A.D. And I said, yes. They said, oh, that's great. We've been trying to get her. So there you go.
That's awesome.
So
Well,
there
I'm
you
glad
go,
that you
my
went.
dear.
You were such a good sport, and we appreciate you. And it's so nice because, and that's why I sent you, is because you are a nurse practitioner. You've been through this before. You also have P.A.D. And so you were the perfect person, and you did such a wonderful job explaining everything in you know, not only clinical detail, but also layman's detail so everyone can understand. And we had the perfect group of people here that really needed a little bit of extra hope, you know, along the journey. It's nice to know that these things are coming out and that there's more options aside from just walking to grow collateral vessels, because that's the biggest concern is, what if I can't walk? What if I
Well,
have other
you know,
things going on and I don't want to
you
lose
know,
my
I
leg?
couldn't walk. You know, I
Yeah.
couldn't walk
Mm.
because I've got back involvement with a whole nother disorder, but I can't walk. So I
Yeah.
had to find something, and I am so good at finding and researching.
Yes, you are.
If
Yes,
it's
you
there,
are.
I'll find it. Believe me, and if it's not, I'll invent it. So,
I
so we'll
love
see.
it. Well, thanks
All right.
everyone for joining
right,
us. If you want to stick around afterwards, you can. I just want to end the live part of it. And if people want to be in the live studio audience, make sure you email info@padhelp.org. We have such fun discussions. We're really candid. We're real human beings. We're not necessarily politically correct or clinically correct. Always check with your own doctor. We don't give medical advice at all. We're just here to have comprehensive education and to give you some food for thought to have a more productive and satisfying conversation with your own care team. So important to know. But thanks everyone for joining us. And if you're watching on YouTube, go ahead and just subscribe to the channel. That would be great.
All right.
Okay.